Good afternoon, good morning, ladies and gentlemen. Welcome to the October edition of AFRAA's SkyConnect Leadership Dialogues. And a warm welcome to all from AFRAA in Nairobi. Every month, the AFRAA SkyConnect Leadership Dialogues hosts a top executive from aviation, tourism, trade, and financial sectors for a thought-provoking one-on-one dialogue on matters relevant to the aviation development. My name is Maureen Kahonge, Senior Manager, Business Development and Communications at AFRAA, and I will be your host for today. I am standing in for Rafael Kuchi, who could not join us due to other commitments. Our guest on stage today is Dr. Mohammed Abdulaziz, the Head Division of Surveillance and Disease Intelligence from Africa CDC. Ladies and gentlemen, for the next 1 hour, we shall have a thought-provoking dialogue with Dr. Abdulaziz. With him, he will discuss with us Africa CDC's laudable initiatives that are being spearheaded under the African Union. And this all is geared to facilitate a risk-based approach for a safe restart of air travel in Africa. We shall discuss today Africa CDC's role before, during the pandemic, and all the initiatives that they are putting in place in collaboration with other stakeholders to put back to normal the aviation industry. In particular, we shall examine border controls, movement restrictions, and the impact these have had on life and business across Africa. We'll also look at what are the measures that have been introduced by health authorities to control COVID-19 and ongoing progress over the vaccination. Finally, we will look at views of Africa CDC on the process of returning to normal and what recommendations Africa CDCs have for airlines to encourage more travel and what guidance Africa CDC offers on how to prepare for future pandemics. Expect nothing but out-of-the-box thinking and far-reaching recommendations to shape a safe restart of Africa's aviation. Dr. Abdulaziz, welcome to the show. Thank you for accepting to take the stage and share with us your industry perspectives for a safe restart. AFRAA is delighted to host you. Welcome.
Thank you. Thank you so much. I'm also very happy to be here. At Africa CDC, we recognize that we need to work with every single stakeholder partner to ensure that we get Africa back on track in terms of economic development. We know that investment in health is very good investment because it's only when people are healthy and able to move around that economic development can continue to take place. Thank you. My apologies for the fact that I'm on travel and not in the office, but we will try to have a good discussion today. Over to you.
Thank you. We do appreciate taking your time to discuss with us. Before we start, just a few housekeeping announcements. All the video and audio functionalities are disabled for a better quality of the session. However, we have the chat function open and the Q&A. Please use the chat functionality to post your comments. You can let us know where you're joining us from. And for your questions and answers to be taken by the guest on stage, please use the Q&A tab so that we can be able to take the questions as we move. We shall be having a very relaxed discussion with Dr. Abdulaziz, and I will take questions on the go. Please keep your questions coming in, and at the tail end of the session, all the questions that are not answered, we shall endeavor to give you response post the webinar. We now embark to the show. Dr. Abdulaziz, please give us a brief introduction about your role at Africa CDC.
Thank you so much. First, let me thank the African Airline Association for inviting me to this webinar, inviting Africa CDC to this webinar. We consider you a natural partner in terms of development and economic emancipation of our people from the COVID-19 pandemic. My name is Dr. Mohammed Abdulaziz. I head the division of disease control and prevention in full capacity at the African Union Commission, but I'm the acting head of surveillance and disease intelligence for the same Africa CDC. I'm also when it comes to saving life livelihood, I take lead in the Africa CDC Trusted Travel Initiative, and also I head the work stream of the country engagement technical assistant for member states from the Africa CDC Saving Life and Livelihood partnership with MasterCard Foundation. Thank you. Over to you.
Thank you very much for your brief introduction. And you mentioned that you are the lead of the initiative for the safe reopening of borders. We as a travel industry, AFRAA in particular, we commend the proactive joint initiative of the AU with the African ministers responsible for health, ICT, and transport on the Africa Against COVID-19 campaign for saving lives, economies, and livelihoods. The multisectoral task force behind this campaign made a call to action to African states earlier in this year, and this call to action still is ongoing. And the call was on various key areas for the resumption of air travel. Africa CDC is a secretariat of this task force. What is this call to action all about, and what are the specific recommendations that were made by this task force?
Again, an excellent question. And thank you very much for I'm happy when people know exactly what we are doing and what needs to be done. And to also let you know that actually in August 20th, 2020, the head of states of an assembly of the African Union Commission with the chairperson of regional economic communities of the African Union endorsed the Africa Centers for Disease Control and Prevention campaign on Africa Against COVID-19, Saving Life, Economy, and Livelihood. The Africa Against COVID-19 campaign, Saving Life and Economy and Livelihood, has three main goals. The first goal is to minimize the spread of infection within and across border by creating a public health safe corridor to safe travel through one, registration of COVID-19 testing for border crossing supported by PACT initiative, deploying a cross-border tool platform to ensure verifiable and credible COVID-19 information, e.g. testing results, and mechanism to collect additional data and evidence to guide focused intervention, e.g. sero survey, rapid mortality surveillance, and additional research. So the second goal is to minimize the impacts of COVID-19 on economies and livelihood through employing digital framework for tracking and sharing of critical information to support creation of the safe public health corridor, to support the mutual recognition of health information provided by state parties within the existing framework for protecting borders and economies, and strengthening the risk communication to address misconceptions and infodemics. The third goal is to ensure safe reopening of schools through developing to develop school opening safety plans and allocate resources for the protection of students and staff, establishment and engagement of multisectoral community continuously, and monitor the safety of students and staff, and assess risk and advise accordingly, mobilize resources for continuous achievement of the resources. Let me take us back to the first goal, which is to minimize the spread of infection within and across the border by creating a public health corridor for safe travel. What does that mean? It means we want a situation in which our countries, our people will be able to move across borders in a safe way. Safe for the country where I'm going, and when I'm coming back, safe for the country I'm coming back to. Let me give you an example. I'm currently in Berlin, Germany, and I traveled before I left Addis Ababa. I had a COVID test. There should be a way that the authorities in Berlin here should be able to verify that the COVID test I've done is genuine, it's safe, and they have trust in that COVID test so that I can be able to get on that airline and travel without being hindered. So you see, it creates an opportunity for people to be able to travel. This is what we want. We don't want this pandemic, as it did in 2020, to run us down. We want people to travel. How do we ensure people travel? By having procedures that are trusted by the country you're living, by the airline, because they have to protect their staff, by the country you're going to, so that you can go, trade, do whatever you want to do, and return back. Again, when I want to go back to Ethiopia, Ethiopia should have a safe way of ensuring that when I'm coming back to Addis, I'm not going to bring the COVID-19 virus for them. These are the systems that we are putting in place and working with our partners. We're working with Panabios, we're working with EcoNet, so that these systems are in place and be able to move forward. Our people can be able to move across the continent and even further and come back doing their business at the least inconvenience for all. If I'm traveling from Addis, I'm going through Frankfurt and then coming to Berlin. By the time I get, or let's say going to Paris, by the time I finish unload, I should be able to get off in Paris without anybody. So we have created a situation in which our implementing partners can be able to do that, working in close association with airlines, ensure that our people are able to still travel. This is the most important thing, because if we ground ourselves, we will ground our economy. And if we ground our economy, then we will be in trouble. So these are some of what we are doing. I will maybe subsequently, I will also address the issue of the vaccine passport as we go ahead. Thank you. Over to you.
Thank you. Those are very laudable objectives of the multisectoral task force. And indeed, in the course of today's discussion, we look at the various line items mentioned, for example, the digitization of the health protocols and interoperability, the harmonization of health protocol as well, and the vaccination process progress in Africa. This task force, you have mentioned that you have implementing partners. So who are these implementing partners, and who else is part of this multi-sectoral task force?
So for this multi-sectoral task force, we have all partners that are part of the stakeholders in moving people within the continent in a safe and trusted way. So we have the World Health Organization, we have, of course, the Africa CDC, we have the International Civil Aviation Organization, we have the Africa Civil Aviation Commission, we have the International Air Transportation Association, AITA, we have the Airports Council International, and of course, the African Airline Association. I'm so glad the African Airline Association is part of this and making a concerted effort, like this webinar you are doing, to let people understand what needs to be done to move things around. If you look at some of what we see, it makes me to be very proud as an African that even moving our vaccines around, we see African Airline being involved in moving vaccine around, being involved in moving, when there was lockdown, African Airlines took part actively in ensuring that we do not run out of materials. We will have run out of materials on the continent. Logistics like medicines, like laboratory consumables, like even test kits. African Airlines worked day and night to ensure that Africans are fully supplied with all of this. So these are some of the things that we talked about. Others, of course, include the other departments of the African Union, like the Department of Trade and Industry of the African Union Commission. So we are working with all of these partners to ensure that we sit together, take decisions that will be able to impact on the success of our safe reopening of our economy, which has been going on for 1 year now. We are reopening, and also consider the SOPs, modify it as we go on, as more evidence are coming, to be able to ensure that we take the right decision. Right now, we are saying people should travel, can only travel with maybe a PCR test, but we are also looking at the latest data, so that we make it easier for our people to travel. But it has to be in a safe way and in a way that we use the best available evidence to make those decisions. Thank you.
Thank you very much. And we look at the first aspect and the objectives of the task force, the digitization of health credentials for travelers for testing and vaccination. As more and more governments require either verified testing and eventually vaccination proof as a condition for international travel during and after the COVID-19 pandemic, there is need for African governments to embrace the use of digital technology as a way to facilitate and verify passenger health credentials. What we observe in practice is that this space is quite low. We don't have a good progress to date of the adoption by African governments of these digital platforms. So what is the progress to date on the implementation and usage of the AU Trusted Traveler platform?
Yes, thank you. Thank you so much. Like you say, the process is not as fast as we would have loved to. We have two implementing partners that we're working very closely with, Econet and Panabios, and we give all of them the
Lost you.
Hello, can you hear me?
Yes, please retake your response. We lost you.
Okay, sorry, I'm actually using Wi-Fi, so it may be going on and off. Once I'm off, let me know. So what I'm saying is that the Africa travel, we have two partners, the Panabios and we give them all the cover they need to be able to get African countries on board this trusted travel. The objective of this trusted travel is that any passenger leaving any country should be able to do his test in a lab that is accredited by the country, not by our implementing partner. Can you hear me?
Yes, I can.
By the country, accredited by the country, certified by the country, and be able to certify by other people that this testing is correct and genuine. They should be able to upload it on a system where the passenger, all through his travel, should be able to, in a verifiable and trusted way, able to say he has done the test. It's in conformity with the rules of the country. We don't make the rules, the country make the rules. Some countries say 24 hours, some say 48 hours, some say 72 hours validity for PCR, some say RDDT. We don't make the rules, but advise country and we tell them this is what is optimum based on science and based on the evidence we have currently. So now the passenger should be able to move through, or even when you have the paper test, lose it. My experience in Nairobi, when I was traveling, I came to Nairobi. Kenya is using the Africa Trusted Travel, I think deployed by Panabios. And when I got to Jomo Kenyatta Airport, I've lost my test. I searched my bag, I couldn't. All what the person did in other countries, I would have gone back. I would not be able to travel. But what the person told me is that, please, can I have your passport number? He put in my, I'm pressed. I saw my COVID test, which says negative, which allowed him to allow me to move forward to the airline counter. He will have turned me back the gate and said, you can travel. It's the things we want. We are tired of people able to travel because things, or you get to a country and they start looking at tests and know we can. So this digitalization enhance two things. First, it shows your test is genuine and okay. Two, it allows you access to the test throughout your period without having to carry paper tests. Even if you lose the paper test, like it happened to me in Nairobi, they can verifiably say, yes, you've done, using maybe just your passport number, key it into it, and they will be able to say, you've done your test, please carry on to the counter. The airline should be able to put in your number and say, oh, this guy has done his test, and check whether, because I know this is important to airline, is it in conformity with what the host country that is going to has set for you? Check, and oh, okay, this is good, please proceed. It's just like the normal way you check people's passport and visas, and with the least amount of inconvenience. So that's what we've done. In terms of the reach, I don't have the most recent data, but I know right now it's operational in countries like Ghana, Ethiopia, like even like I said, Kenya. And I think a couple of more countries have come on board. I've not gotten the most recent data, both in terms of the Panabio system and the EcoNet system. Are we at where we want to be? No. But am I confident that we will get there? Yes. Thank you so much. Over to you.
Yeah, very commendable ways that the digital platforms make the travel experience very efficient, and also the very important aspect of the credibility of these tests. Our airlines brought to our attention that one of the challenges that they are facing is the presentation of paper certificates for COVID tests, but these are fake test results. And looking at what the multisectoral task force has done and is doing is now to see how can these digital platforms talk together, and how can we fast track the adoption of these digital platforms and usage by the African states. So what is Africa CDC doing to synergize the digital platforms that we have, the leading ones being the IATA Travel Pass, and most recently, the East African Pass?
So that's a very good question. We acknowledge the IATA Pass and the East Africa Pass. Even in West Africa, we hear of the WAHO. One thing we need to understand is at Africa CDC, when we started this, it was like, let's prove a concept. Let's prove Africans can do it, and let's get it done. Now we're at another level, and when Africa CDC Trusted Travel was launched in October 2020, and now we are in October 2022. That's exactly 1 year now. So what we plan to do is we are taking stock. We have the some of the challenges that we've seen with the system, like you said, the problem of interoperability of the different systems, how they talk to each other, and again, how do we go beyond just tests? Now we are supporting many countries to get vaccinated, vaccines. So what that means is that, like when I was coming here, I was asked for my vaccine passport. It's for Germany, it's not a must, but it gives you an advantage. If you have your vaccine passport, you may not necessarily need to do your COVID test, but they need to be able to verify that your vaccine passport is genuine, that you actually took that vaccine. And if they can't verify it, they may waive the COVID test for you. Now, if you look at the COVID test, and that's why we say airlines should support us on this. If the COVID test in different parts of Africa can cost from between $50 to $150, that is an added economic burden to people traveling. So if, for instance, a vaccine test can say, oh, if you have that vaccine test, you do not necessarily need to do a COVID test. And this is what they do maybe in Germany, for instance, where I am. So what that means is that we should be able to get Africans who have been vaccinated to enter Germany without a COVID test, not just other parts of the world. So this is some of the issues that we are also seeing, and we are trying to see how we can overcome some of these challenges. I think by the end of October, there will be a big conference where everybody, the stakeholders, will be invited. I think we're already sending save the dates. Today we'll start sending save the dates to all stakeholders, where we take stock of what we've done in the past 1 year. And the Director of Africa CDC, talking with stakeholders like you, like IATA, like ICAO, like the East African Community, West African Health Organization, coming together, we may now be able to say, okay, now that we've shown that this thing can work, how do we ensure that we work as a continent? So the conference that we're tagging, Trusted Travel +1, that's where after 1 year, we will be able to see how we can work together as a continent to provide the best solution to some of the challenges that have emerged. But it's better for us to have a system that we are working with that has now shown some challenges, which we will tackle them, for us not to have anything at all. And then we will now be the ones to suffer. Our citizens will not be able to move seamlessly around like other citizens, and that's the worst thing that can happen. Thank you. Over to you.
Thank you very much. And our next subject will be on the lifting of travel restrictions. But before we go to that, we have a comment and a question from Mr. Barry Kashambo, ICAO Regional Director for Eastern and Southern Africa Office. Mr. Kashambo, welcome to the forum. Thank you for your input. Mr. Kashambo says that it's important to notice the desire for ease of travel has been prevalent even before COVID-19, and AU Agenda 2063 spells it out clearly through the context of visa restrictions. You are absolutely right in promoting and fostering recognition of vaccination and PCR tests. As part of the multisectoral task force, Mr. Kashambo says that ICAO is ready to support the three key goals. However, the question is, how can we get African states walk the talk and set the scene by recognizing each other's documentation even before other continents recognize our regional outcomes? Currently, the intercontinental restrictions don't reflect the task force desires. What's your take on this, Dr. Abdulaziz?
Really, thank you, the director, for such an excellent way of putting it. We in Africa, we must have a way of ensuring that we can verify our documents and trust and allow people to move, even within Africa, before we even talk about going outside of Africa. This is really critical, and it's critical that we should be able to use a way to ensure that even if somebody is going from Benin Republic to Nigeria, there should be a way to verify all of the documents and allow safe movement. The keyword is safe movement. And for now, the mechanism that is put in place for people to be able to move safely is, of course, do a test before you leave. When you test negative, whichever test, get vaccinated. And get vaccinated in a way that we can be able to verify sorry for the background noise, because we should be able to verify that I have been vaccinated, and if I'm moving from Addis Ababa to Abuja, it should be, if Nigeria says any person who is vaccinated can move, then there should be a way for Nigeria to verify my vaccination passport, the one I took from Addis Ababa. Let me make a very key statement here. The African Union does not support mandatory vaccination passports. No, we do not support it. We do not support that you should ask for our citizens to mandatorily vaccinate themselves before they travel. However, what we do support is if any country that has an exemption because of vaccination status, we say it must also be for Africans. So if Germany says people can come into Germany who have been vaccinated, Africans who have been vaccinated should be able to come into Germany without doing a COVID test. So the director is very right. If we do not accept that in Africa, how do we ensure that people outside Africa accept it? And at the African Union Commission, Africa CDC, through various policies, through various meetings, have been doing that to ensure that we are bringing people together. We are bringing those who will be taking those decisions together. At the end of this month, we'll be bringing in both the ministers of health and the ministers of transport in a virtual meeting to look at trusted travel plus 1 year and see how we can further ensure that these policies are implemented by our member state. Thank you so much for that wonderful question and comment.
Yeah, indeed, a coordinated approach is important and is key for us to progress, starting from the various states, ministries, concerned ministries, and even looking at the regional economic communities. We need to have that coordinated approach for an efficient recognition of and standardization of all these protocols. Just to mention that we'll be having an ICAO high-level conference on COVID-19, and we certainly do look forward to having some key take-homes and actions and engagement at all these levels so that we can have some in practice actions that we can start to resume our operations efficiently, because there's a lot of talk and a lot of recommendations. However, the situation in practice does not reflect much progress as we would have desired. And now moving on to the next item, which is on the lifting of travel restrictions. 2021 marks the second year we have had the border restrictions due to COVID. And according to AFRAA estimates, African Airlines lost in 2020 a total of $10.21 billion in revenues due to the impact of the pandemic. And we estimate that the revenue lost for 2021 will be at $8.2 billion US. 8 African airlines in 2020 went into administration or into bankruptcy as a result of the impacts of the pandemic. Therefore, the lifting of travel restrictions is a top priority that the industry needs to address for us to restart. Indeed, we have a lot of measures for the restart in place. However, the challenge is that each state makes individual decisions as to what they want to do, often on the basis of varying information. Some other regions are imposing travel restrictions to African citizens, travel bans, and vaccination passports. For instance, on 24th of September, Africa CDC issued a statement on the UK travel restrictions, noting with concern the changes to international travel rules by the government of UK, which took effect on 4th of October. These rules discriminate between the recipient of COVID vaccines, which is not based on the vaccine received, but it is based on where they received this COVID-19 vaccine, including but not limited to African Union member states. These restrictions apply to recipients of vaccines through the COVAX program. The measures include 2 additional tests. There is a pre-departure test and a test to be taken on the 8th day, and a quarantine for 10 days for Africans who have been vaccinated in Africa. This further deepens the vaccine hesitancy across Africa and creates distrust in the community. What is the outcome of Africa CDC's call to the government of UK? And how else can we get states to change their views? Over to you.
Thank you. As you have rightly mentioned, Africa CDC views those policies by the UK government and other government that are following through as discriminatory, and Africa CDC has released a statement on that to ensure that we send a very strong voice to oppose those kind of quietly unhelpful decisions by other governments. However, these are governments that take decisions without consulting the African Union, and we will continue to dialogue and talk, and at the highest level. Don't forget that Africa CDC is within the African Union Commission, and we have other departments within the Commission that are talking on this. For instance, we have the Department of Travel within the AU Commission itself, and I'm sure they are in talk with the different partners and governments to ensure that this kind of unhelpful decisions taken by them reversed, or at least we are able to register our strong and like the Africa CDC did in that press release. We want to the people in Africa to know that the vaccines they are taking are safe. The vaccines we are using are the same as the ones that are being used in different parts of the world, and coming from the same manufacturers. And that's why we don't. It doesn't make sense for us for you to discriminate based on where people have taken vaccines, and we see it as also, like you say, likely to have effect on how we respond to COVID-19 on the African continent. Let me say very clearly here: no one is safe until everybody is safe. If we disadvantage one part of the world like Africa, then it's a matter of time before we are all back to square one. COVID-19 is an RNA virus, highly unstable. The only way the whole world can be safe from it is if we work together to ensure that it does not have a place where it becomes endemic, and then it begins to different kind of variants, and with time that can also be a problem for the for different parts of the world. So we will continue through talking between Africa CDC and different partners and stakeholders. But of course, the African Union Commission as a whole will continue to push the case and ensure that people do not, countries do not place this kind of quietly decisions that are not born out of evidence They are just born out of they are arbitrary and not do not come from any scientific evidence and place it there and make Africa to have to scramble. But we will, as we've shown by Africa CDC recent partnership with MasterCard Foundation, will continue to push very hard to ensure that we get Africans vaccinated to 60% herd immunity by the year 2022 ending. Thank you. Over to you.
Indeed, a lot needs to be done by stakeholders to work with African governments and third countries and other regions to ensure that governments open their markets to restart the industry with support from the industry restart plan standards and guidance documentation, specifically the ICAO CART recommendation. And looking at vaccine access and vaccination, indeed, as you mentioned, no one is safe until everyone is safe. Very good slogan. However, in Africa to date, less than 4% of Africans are fully vaccinated. These numbers are not looking very good, and it compares unfavorably with the progress that is being seen across the other regions. Earlier in the year, WHO had forecast to have 40% of Africans fully vaccinated by December 2021, and 70% of Africans vaccinated by mid-2022. These numbers that we are seeing in practice, we are not where we would have desired to be. What are the reasons behind this low vaccination pace? And I see also we have a similar question from the floor, Ambrose Akadonda, who is asking, what is Africa CDC doing to mitigate vaccine hesitancy in some sections of people in Africa? So you can take those two questions in one. Sorry, Dr. Abdulaziz, you're on mute.
You would think after 2 years of doing this, we know how to do it very well. So what are the factors that have been responsible for Africa to have such a very low vaccination coverage? They are multifacets. First, we've heard so much about vaccine nationalism, where Africa has been left out, so to speak, in terms of vaccine distribution, we could not get access to vaccine as fast as we will want it to get to the continent. If you do not have vaccines, you cannot vaccinate. That's as simple as that. The second is that we are not manufacturing vaccines on the continent for now. And this is one thing Africa CDC is working very hard to change. If you have to wait until other countries get to 60% before they think of giving you vaccine, then there is a problem. We cannot have health security on the continent if we import virtually 100% of the vaccines we use on the continent. It's not possible. So Africa CDC is working very hard on that to see how down the line, down the years, that can change. The third factor that is responsible is, which is also the answer to the next your question. Of course, vaccine hesitance. When the social media explodes with all sorts of unfounded allegations against vaccination, a procedure that has saved in public health, in the history of public health, we don't have any activity or procedure that have saved more lives than vaccination. Some of the people propagating this anti-vaccine today are alive today because they were vaccinated as children. We do not see the huge outbreaks of measles, polio, and some of us were born after smallpox have been eradicated. We don't even know what smallpox is, some of the generation that we have now, which will not have been possible without vaccines. We don't see people the way we used to see in the past with end-stage TB, because quite frankly, people get vaccinated with BCG at birth. In the past, we used to see huge outbreak of meningococcal meningitis all over the place. Now we just see sporadic outbreaks in the meningitic belt. We've used vaccine to eradicate smallpox. We're on the verge of eradicating polio. So vaccine hesitancy targeted at people in Africa also have contributed to that low level of vaccination. However, I'm happy to say that Africa CDC is making very strong pushbacks to be able to get us to where we want to be. So in a collaboration with MasterCard Foundation, we plan to get Africa to the 60% mark by the end of 2022. And that process, that program of Africa CDC called is still part of the Saving Life and Livelihood, is funded by the MasterCard Foundation to a tone of 1.3 billion USD. And it will be supporting some of the challenges I've mentioned. First, it will be supporting delivery of vaccines to member states. It will be supporting delivery of vaccine from the central medical of member states to where the vaccines will be administered. That's the vaccination center. It will be supporting risk communication and community engagement, where frankly we'll be talking to our people and letting them understand the risk of not being vaccinated and the benefits of getting vaccinated. We now know that the outbreaks, the fourth wave we are seeing in some countries is a wave of unvaccinated people. People that are unvaccinated are the ones dying now from COVID-19. But of course, a lot of Africans are still unvaccinated. So we will be supporting risk communication and community engagement. We will be supporting pharmacovigilance, that's reporting of adverse events following immunization. We will also be supporting the processes of setting up vaccination centers in different African countries so that more people will have access to vaccination. And then, very importantly, the process will be supporting the local manufacturing of vaccination on the African continent. We want a situation in which 10 years down the line, if there is another pandemic, we know there will be another pandemic. It's just a matter of time. At that point, Africa can be able to produce at least 50% of the vaccines it requires. So these are some of the areas that we are putting a lot of pressure to ensure that a lot of activity, a lot of focus to ensure that we change what we see on ground now. In the future, if there is another pandemic, we will have more vaccines produced on the continent. And let me let you know that just about 6 months ago, there was a massive conference attended by 5 heads of state, including President Ramaphosa and some of his other colleagues, who the main purpose of that meeting is how will Africa attain vaccine security for the next pandemic. Thank you.
Very impressive plans and measures that you are taking as Africa CDC with your implementation partners. We do look forward to having moved from the current less than 4% of fully vaccinated Africans now to over 60% that is targeted to at the end of 2022. Moving on to our next item is on the issue of COVID test cost and impact of air travel. The PCR test costs are very high in some African states. The cost and type of tests remain a limiting factor across Africa, with the PCR test being the standard test required by states, costing between $30 to $150 per test across various countries in Africa. The PCR test cost places African aviation at a significant disadvantage. From various studies which have revealed the impact, there is a very significant impact of the increase of costs, showing that an increase of 10% of travel costs can reduce the demand at continental level by 15%. AFRAA's call to governments is for the reduction of these high costs of testing fees. What is Africa CDC's position on this?
Yes, and thank you so much. The decision on which kind of test and at what frequency will be conducted is entirely the decision of the member states. We recognize that in Africa CDC. And but we try to provide guidance, we try to provide evidence, and discuss with them the latest evidence based on what we feel is right in terms of safe reopening. You are very right. We must look for a way of reducing this cost. If to make a round trip from Africa to China or to New York and come back, if you need to spend $300 for testing only, then you would think twice before embarking on that. If you want to move from Nairobi to Lagos and you need to spend $400 for testing, you would think twice before that. And that is not just, it's not just African airlines that are put at, we are putting our economies at risk. We are putting our recovery at risk. It goes against the Africa Agenda 2063. It goes against the Africa Continental Free Trade Agreement that our head of state just signed and gets ratified. So what do? We have to balance this reopening with to be sure that we are reopening in a safe way. What Africa CDC is doing is what I've told you earlier. We are already calling, we'll be sending for a meeting, the Trusted Travel +1, where we'll meet in the ending of October with the Ministers of Health and Ministers of Transport to look at that process. See how, do we have evidence to say that, like other countries are doing, they are adopting the antigen rapid test, which is much cheaper. Do we have safe corridors where we can say, okay, look at, it's safe to travel between this country and this country because they are at the same level. These are some of the ideas that we are looking at to see how can we ensure that we bring down the cost of travel. Like I said earlier, the best way to do this is for us to get the level of vaccination on the continent to 60%. And what that means is that we now have a critical body of people that are immunized against COVID-19. And it means it cannot spread easily among the population. And then we can now begin to think of allowing people to travel with a vaccine passport without having to request them to do COVID tests. So these are some of, and we critically understand this in Africa CDC, and that is why we are working day and night to ensure that the level of vaccination on the continent goes quickly high. We've set for ourselves a target of December 2022 to get the continent to 60%. And we believe with 60%, we can be able to give less stringent recommendation on people traveling around within the continent. And we are also exploring other methods like safe corridors, like I've seen somebody talking about the antigen rapid test as a substitute to the PCR testing. All of these are being considered, but you see, for Africa CDC, we need to have the established evidence before these decisions can be taken. Thank you. Over to you.
Very well articulated on the various options to counter the high cost of the PCR tests, including safe corridor and the rapid antigen tests. And this responds to the question that had been posted by Adefunke Adeyemi on how Africa CDC is promoting the use of other viable alternatives to the PCR tests. And we have a comment again from Mr. Kashambo before we proceed to the next item, still on the vaccination. And he says that the current vaccination rate is at over 6.4 billion persons being administered. It's factual that the majority remaining unvaccinated persons are from Africa. Vaccines will soon be vastly available when all other continents have been vaccinated. Could it be more logical to concentrate on ensuring consolidation awareness to build a strong base for future protect of population? I think protection of populations. Investment in production of vaccines might not be a cost-effective way as is perceived currently. The weakness in Africa will remain to be more of behavior and attitude deficiencies rather than availability of vaccines. The data collected and presented is wanting. The numbers presented to the world on the situation in Africa is likely to be underestimated. This is just a comment from Mr. Kashambo. Maybe you can react to this before we go to the next point.
Yes, let me react to this very well. Mr. Kashambo, there is no way we will have health security in Africa if we do not address the issue of local manufacturing of vaccines. If COVID-19 had been killing maybe a case fatality rate of 50%, God forbid. What I'm trying to say is that if it's killing 50 out of 100 people it infects, the time we waited before vaccines started arriving in Africa will have been counting hundreds of thousands of fatality. So do not for one think we can achieve health security without local manufacturing of vaccines. The availability of vaccine is a big problem, and I'll tell you why. People in parts of the world started vaccinating when December last 2020. When was the first vaccines administered in Africa? Think for yourself. We are talking about months. So if we do not address that, we will be prepared. We will be talking about this pandemic, but we'll forget about the future pandemic. Don't forget that as an epidemiologist, I know that there will be another pandemic. History have shown us that. We human beings, for as long as we keep interacting with animals, traveling as we do, we will still have more pandemics, and we have to be prepared for those pandemics. So we need to be sure to ensure that we build the capacity. I'm not talking about for COVID now. I'm talking about the capacity for production of vaccines on the continent so that we can protect ourselves against future pandemic. Yes. Now, at the same time, we will be addressing issues of vaccine hesitancy. We will be addressing the fact that our people believe in all sort of quietly unbelievable things they see on social media, talking about vaccine in the wrong way. We will have to address that. We will have to ensure that we continue to let people understand the benefits of being vaccinated. Data have shown. I will have shown you that graph if I was doing a PowerPoint presentation that shows that 90% of those dying from COVID-19 these days are those that are unvaccinated. That's just the truth. So what does that mean? That means that people who are unvaccinated in Africa are at risk of dying of COVID-19. As simple as that. And unless we are able to get this vaccination to the level that is acceptable, we will at one point or the other be allowing the rise of another variant of COVID-19. And that is why I said nobody is safe until all are safe. So Africa CDC will continue to support the development of local manufacturing of vaccine, while at the same time supporting very actively the process of addressing vaccine hesitancy and getting more and more of our people to get COVID-19 vaccines and protection against the virus. Thank you. Over to you.
It's a lot of insights there, Dr. Abdulaziz, and it's unfortunate that we're running out of time. However, we will be summing up in a few. The other aspect is on the harmonization of health protocols and passenger confidence. The safe reopening of borders in a harmonized manner is critical for the restart of African aviation and air travel at large. Different protocols across the continent create traveler confusion and further keeps traffic depressed. A recent study by IATA revealed that there is high passenger confidence with travel experience. However, the challenge lies in the stringent COVID-19 rules. Travelers revealed in this study that the rules are too complex and the paperwork too onerous. To secure the recovery, governments need to simplify the procedures, restore the freedom to travel, and adapt digital solutions to issue and manage travel health credentials. Among those who were part of this study and traveled since June 2020, 86% felt safe on board the flight owing to the COVID-19 measures. 73% of those who had traveled found it challenging to understand what rules applied for a trip. And 73% felt that the COVID-19 paperwork was challenging to arrange, and this was had increased significantly from the survey done last year. And with more markets starting to open to travel, one of the areas that we need to address is the harmonization of COVID-related protocols and requirements, as well as how do we communicate to our passengers to ensure that they are fully informed of all the requirements that they need for their travel. What is Africa CDC's take on this?
Really, thank you so much for really excellent questions. And I will not pretend to have all the answers to the question. However, I will strongly also invite AFRAA, IATA, and all the stakeholders. We will be sending you official invitation to join this big meeting we are organizing at the end of October by the African Union Commission, Africa CDC. Because as we all know, we may have the solutions, but adopting the solution by member states always lag behind. So what we can do is ensure that you are at that meeting to ask our political leaders these direct questions. And I will really appreciate, Marion, can you type my email address onto the chat? I will appreciate that this data you just set up, please you send to me so that we can use them as a way of really getting to these political leaders that need to take the right decision, because it's killing our economy if we do not open up the way we are supposed to. But we also need to open up in a safe way. So it's a balancing act. Initially, we do not have anything other than keep safe distance, wear a mask, all this. But now we have other things. We have vaccinations. We have our trusted travel. So as a traveler, if you do not know whether you will be able to get to your destination without being harassed, then we cannot be talking about opening up in a safe way and in a way that we did this. So what it means is, if more and more countries take up the African Union trusted travel, that way, people, if you go to the website of Econet, the website of Panama, you can see every single thing that is required for you to get to wherever destination you are going. However, this does not address the question you asked, which is, how do we harmonize this process? Nigeria accepts 72 hours. Another country accepts 48 hours. Another country will say, no, even after 48, you need to do another test. So how do we harmonize this process? Some of the things we need to talk about. so that our people can travel with more confidence in their mind and know that before they start their journey, they know what is expected of them, and they know they are in. It bleeds my heart when you see passengers in transit being held up and asked to do a COVID test when you're on transit before you can proceed. Meaning, at the beginning of their travel, they did not get to know all the information that is required for them to get to their destination. So all of these are packaged into the Africa CDC Trusted Travel, and we only need to see how we bring in all the different partners and be able to have a truly continental trusted travel that will make our citizens travel in a safe and secure way without fear of harassment or being turned back at the port of entry. Thank you.
This is a lot of actions that we need to discuss, a lot of leading points for the industry stakeholders, as you've mentioned, and we do look forward to that meeting by Africa CDC on Trusted Travel +1, taking place at the end of this month. We also do look forward to the ICAO high-level conference on COVID-19 and to deliberate on concrete actions that we can take as industry stakeholders, as well as with the authorities, so that we can advance on this agenda. And we have come to the tail end of this show, and we have really got some very good insights. So in 1 minute, Dr. Abdulaziz, what is your parting shot or key message to states, aviation companies, partners, and other stakeholders?
Thank you. Thank you. My parting message is that let's be patient. Let's continue to work with all stakeholders, including Africa CDC, so that we can create a system that works for the continent. It is not just the aviation industry. That is, the aviation industry, like I said earlier, has played a crucial role in keeping the continent to go through the COVID-19 pandemic. The aviation industry must benefit from the safe reopening of our economy. Africans must benefit from the safe reopening of our economy. So it's a symbol. We need the aviation industry. We need you, and you need us. So we need to work together for the benefit of our people, so that we do not have an economy that is stagnated. We've seen African countries going into depression because of COVID-19. We don't need that. What we need is a process that works. And I'm going to tell you this. Please try to be present in the meeting we'll be having with the ministers of health and ministers of transport on the African continent. The African Union, we're working very closely to see how we will organize this for the ending of this month, so that we can take stock of what we've done very well in the past 1 year, where the challenges are, what needs to be done to address those challenges. You will have the opportunity to talk directly to these people and ask them questions. They will need to respond and tell us how we can make changes and ensure that we move from where we are and to where we really want to be. We've shown that we can do it, but let's address the challenges so that we can be able to do it more efficiently. Thank you so much. I really appreciate being on this platform. I appreciate all our partners in the task force. We will be working with the Director of Africa CDC to see how we will improve the functioning of that task force and ensure that we are able to achieve what we set up that task force for, which is really to safely open our economy and working very well with the aviation industry. Thank you, and over to you.
Much appreciated inputs, very well put, Dr. Abdulaziz. We thank you profusely for making time and sharing with us all these insights from Africa CDC. And certainly the conversation needs to keep going because there's a lot of work to be done. and a lot of progress that needs to be made for us to be where we want to be in 2021 and beyond. Ladies and gentlemen, allow me to make a couple of announcements. We have forthcoming events that are of importance to note. The next SkyConnect edition, we will host AFRAA Director of Export and Development, Ms. Olurati Doherty, and she will share with us the role of AFRAA in socio-economic development in Africa. She'll also give us insights on the bank's support to combat the COVID-19 pandemic. What were the successes? What are the challenges learned? And she'll also give us information on the bank's support to African aviation, in particular with governments and privately owned airlines, as well as with airports. The link will be posted on the chat by our AFRAA team, and you can register to attend that show for next month. The next event we have is the AFRAA Women and Youth in Aviation Conference, which is sponsored by Collins Aerospace, taking place from 19th to 20th of October. We have on 19th a very exciting agenda on women in aviation, and on 20th on the development of youth in aviation. We do look forward to your participation. The link as well will be put on the chat box. And this sums up today's show.
Bye-bye.
Bye-bye.